This is Doug Fletcher, and you're listening to What's the Hazard? It's good to have you.
Thank you.
I'm not talking to you guys yet.
Oh.
And there's the camera. Don't look at it.
Okay.
But there's where the camera is.
Okay.
No, absolutely. It's great to see you guys. It is Friday, May 13th. Either of you superstitious?
No.
It's Friday the 13th.
I didn't even think about it until you said that.
It doesn't cross your mind?
No.
I always notice when it's Friday the 13th. I do have a few superstitions that I won't get into in great detail, but...
I'm so scatterbrained. I don't even want to admit that I didn't really recognize what day of the week
but
or
you
what
made
day
it here
it
on
was.
time, so I appreciate that.
Yep.
It's good to have you. My guests today are both from CHI Health Systems. Robyn Burnett, your title I couldn't even begin to try to explain. Joanne Bartels, neither for you either. So what I'm going to ask you to do is both give your titles and explain what that actually means. Would you be willing to do that for me?
I'll start it off because mine's a short version. Joanne has much more experience in CHI, and I think it'd be great for her to share how she started and got into the position that she's in now. But I'm the Director of Employer Relations and Growth. So it's a brand new position. CHI's never had something like this. They've had different entities throughout the health system that went out and represented and sold different service lines, but they didn't really have somebody that could represent all of them and be a conduit to employer groups and broker groups back to the health system. So talking about all the different things that we can offer, whether it is Occ Health, or maybe it's our direct primary care program, or our EAP, or chronic disease management programs, all of those things that could really appeal to employer groups, but they really hadn't had anybody out there being the face of it.
Okay, I like that.
So that's a short version of what I do.
I didn't understand any of that exactly, but so you are interacting with employer groups?
That's correct.
Employers and employer groups.
So historically, CHI has done a really good job of appealing to patients and families on an individual one-to-one basis. So, you're a consumer of healthcare to some capacity, right?
Absolutely.
So we've done a really good job of marketing to that subset of the population, just individuals.
Okay.
But we haven't done a really good job of getting in front of groups as a whole to say, this is how we can appeal to you and lower your healthcare costs, lower your claims, keep your people healthy and productive and working and happy. Those are all things that we hadn't historically done a really good job of doing. So we want to be able to go out there and represent what we can offer employer groups as a whole.
I see. Fantastic.
Yeah.
And you're enjoying it?
I love it.
Good.
I love it. This is the first time I'm out of mental health.
Yeah,
which
that's
is
right.
weird.
I mean, so the last time we spoke specifically about mental health and the employee assistance programs.
Yeah. So I had been in the mental health world since 2008. Working in private practice. I worked in, interestingly enough, where I got my start was in a partial care unit for a manual CHI. Loved it. I wanted to get offered a job there, but at the time they didn't have an opening, so I went elsewhere, and I went in community behavioral health for about 8 years and did management there, managed a team of social workers who would go in and out of homes of people that had mental health issues, trying to keep them out of the hospital. So I did a lot there in that capacity. Then went to another healthcare system and oversaw the EAP program there. Did that for 4 years. And so this is the first time I feel very humbled because for a long time I felt like I knew what I was talking about and felt somewhat of the expert in my field. And now I'm back to square one.
Starting over a little bit.
Yeah.
That's
but
exciting.
it's fun. It's a challenge.
Good. And something you mentioned, one of the things that you offer employers, occupational health services.
Yep.
Joanne, your title, that's how we met, and we have
I was going to say, you guys have a
we
history,
have lived in the
right?
same world now for probably 20 years or so, I think.
When I mentioned your name, she said, I know Doug.
Yeah.
She said, it's been so long. I said, well, let me connect you two.
Yeah. So your title and specifically then what you do.
So my
for
title
CHI.
has evolved over time, but the final title at the moment is Market Development Representative for CHI Health. I've been in the health system for 18 years. Started in Lincoln at St. E's at the hospital in HR and educational services, and that was a newly created position that I took, and to get my foot in the health system. As I have a business degree, I'm not clinical, so I think a lot of people think I don't have a career in healthcare if I don't have a clinical type of degree. But I have a business degree in marketing and management, and I have been, working in occupational health. 2 years after I started at the hospital, I took a position at company care.
Well, this is interesting. Before that, specifically her role, and I think for people listening that may not be familiar with, there was actually a person that had to schedule all of the different conference rooms,
the meetings,
all the, now it's all done through different calendar invites or whatever. But she was the actual physical entity that had to schedule all of that. So she had, I just pictured this massive book.
It was manual,
like
and I had to put it online.
Get a quill and everything there. No, I'm not suggesting that. I'm sorry.
No, but thanks.
We've established that
Remember,
I'm much older than you. That's right.
No, but that was a position where they kind of just threw things in my lap and said, make it work.
Awesome. Yeah.
And so it was fun. But then I got the opportunity to come out to company care, and I actually was an account executive through our physician network in Lincoln specifically. And now that kind of evolved into, now we are all part of CHI Health Clinics. And so we have our Occ Health program not only grew from just Lincoln, but now we are in Omaha, in the Millard area, and then in Council Bluffs. And soon to be clinics out west, hopefully this year, Kearney, and next year, Grand Island.
Oh, fantastic.
And they'll all be called CHI Health Company Care Clinics that we are going to make sure are collaborative across the state, that, provide consistent care and protocols and things of that nature, so that when companies use our services, the communication just flows.
Consistently and uniformly.
Yeah.
What for people that don't really understand what occupational medicine clinics do, what kind of services do you guys offer for your clients?
So we offer anything work-related medical. And when I say that, almost everything. I tell companies, reach out to me. If I don't, if our clinics don't do it, I can usually help you find somebody that does. But we do anything from work injury care. That's our primary people can walk in and be seen for those. Drug screening, physicals, OSHA-related, Department of Transportation-related. We do immunizations. We do wellness, and we do a lot of OSHA specialty physicals like hexavalent chromium, cadmium, some of those companies that have...
I was just doing some silica monitoring at a client last week, and they had a few people over the action level. And I said, you need to get them in, and they're and that's okay. I mean, and we need to get them in and get them into the medical surveillance program per the requirements.
And we do audiograms. Speaking of that, for hearing conservation programs,
awesome.
And we have a lot of partners that if it's something we don't specifically come on site and do, we have a partner that works with us to be able to provide the services that companies need. So respirator clearance, those kinds of things.
Right. Absolutely. Fit testing.
Yep.
So we can talk more about that because I think that stuff is really interesting. One thing I'm interested in, and for the purposes of total transparency, my wife is an employee of CHI. She works at one of the hospitals in Omaha, in the NICU, and she absolutely loves it. And we talked about this just a little bit before we started recording. She was a teacher and became a little bit disenchanted with education, and, that system's challenging, of course, more so of late, I think, and COVID was difficult, particularly in education. So she transferred over. She's back into healthcare. She's like a nurse tech, CNA, and loves it. And I will say, to your credit, to the credit of CHI, in large part, she loves it because she's a hardworking person, and they recognize that and they affirm that. They do little things. I mean, she came home, it's been 2 or 3 weeks ago, with a handwritten note from, some boss. It was like 3 or 4 levels above her. Who just happened to interact with her one day and see that she was working and wrote a note for her. And she was just ecstatic about this. And I was like, we talk about leadership all the time, but something that might seem that minimal just, made her day.
I've been so impressed. I was saying before we started recording, coming from another healthcare system, just how wonderful it has been to work for CHI. And one of my first leadership meetings, we have a Monday leadership huddle, and one of the first ones I noticed, and we do this almost every week, we go around and give kudos to people within the team, but anybody that's not in that huddle, so maybe some subordinates or people that are outside of, I actually work for CHI Health Partners, so maybe it's somebody outside of CHI Health Partners or outside of the room in general. If there's kudos given, we get the thank you cards out and we start passing them around. And there's always, they always do things for employee appreciation. There's always food out. I mean, they're always doing things to really try to up that morale, make sure that we're happy. Because we do have, especially right now in the employees market, we do have a choice of where we work, and they recognize that. So I've been very impressed.
Interesting.
And I'm happy to hear that about your wife as well.
I was too. And I think our friends in industry and in construction, can take a cue from the healthcare world and realize that those things don't cost much. Yeah. They don't take a lot of time or resources, but the impact they have on the employees is remarkable. And, she's sold. I think she's in for, she'll probably work for a few more years, but she's definitely in. And so thank you for that. And I was just wondering if that was intentional. And it sounds like there is some intention behind that.
Yeah. I saw that from day one. We do a great job of that. This is the first job I've had that I don't have a team underneath me. So I feel almost a little naked because I'm used to providing that level of service, from a leadership standpoint. So that's new to me, but I see it in other areas where members of leadership that have teams underneath them, they do a really good job of ensuring that they know that they're valued. But, interestingly enough, because you said your wife is in labor and delivery.
Labor and delivery,
so
NICU, that
I
kind
had
of stuff.
all three of my kids, I don't know if I told you this, at Bergen. And I worked at a different healthcare system. And then my husband works for a third different healthcare system. And they would always laugh every time we came in. We went to Bergen each time.
Right.
They says, well, what do you do? And I said, well, it's kind of funny. I work for this one. He works for this one. They say, you come here? I said, I love it. I love the experience there. And I think your wife probably feels that where she's at too.
I think that speaks volumes of the health system.
It absolutely does. And so I don't mean to get off track here, but how are the staff doing? How are your people doing? Are they recovering? We're gonna talk in terms of pre and post COVID for the rest of our lives, or at least those of us that experienced it. How is everyone doing post COVID? I'm sure that we have to make some ground back up.
I do not work on the front lines, nor do I work with a lot of the frontline people, but I know that the health system has taken steps to recognize that everybody's been through a lot. I know the EAP, they offered 5 extra visits to be able to go and speak with somebody to help them get through all the turmoil of all the COVID and working long hours with less staff. And none of that goes unnoticed or unrecognized. And, like Robyn said, when every meeting we start with recognition of the people that work for us. Like, what are some good things that have happened? And I think going forward, we just probably have better processes in place. We've always planned for pandemics. But I think no one could have planned for one that went on 2 years.
I know.
Yeah.
So
and to the magnitude.
To the magnitude. So I think we've all grown from the experience, and I think it's good.
And people are stretched thin. There's no doubt about it. But that spans different occupations, and that spans, if we're just talking about healthcare, no healthcare system's immune for what people are experiencing right now, and there are a lot of complexities right now. So we can say we're getting further past the pandemic, and you hate to say post-pandemic, like we mentioned earlier, but we're getting further past that. But, you know, we do have to face the financial restrictions that are just there. You know, we were getting, healthcare entities were getting pandemic funding.
Right.
That stopped. So we are in a financial crisis as far as healthcare is concerned. And so one of the things that we're experiencing, and I know other healthcare systems are as well, we're really needing to look at finances. And one of the big finances spent over the last couple of years was getting, you know, traveling nurse and docs in. That's a huge expense. Yeah. And so we're needing to cut that out. And that does take a toll on the staff, and we recognize that. So we're really upping the recruiting efforts right now to get, you know, real full-time staff in there to replace all of those travelers.
Yeah. Are they coming out, are there nursing students available? Are they coming out of school? I mean, is there a good flow of
I know
physicians and nurses?
Yeah, I know that in the midst of pandemic, there were several different nursing schools here in town that had seen record numbers increase for enrollment. So I think in the next year, we're going to see record numbers of those graduating. Yeah. They equated it to, you know, after 9/11, a lot of people enlisted in the military. Well, we saw in the pandemic, a lot of people felt that call to say, I want to be a part of this. Good. I want to help. So they saw those record numbers of people enrolling. But I think that since that's still, that was, you know, a year ago or so. So if they were in an accelerated program, we're going to start to see those graduates come out.
Coming out. Good.
Yeah.
Good. Yeah. That, I hear that occasionally from my wife that there are openings or there are some opportunities for increased staffing perhaps that would be helpful, you know?
Yeah, and Bergen is an academic site.
Is it?
Yes.
So they're teaching and training there?
Yes, we partner with Creighton University.
Of course.
Yes.
Oh, nice. Well, so let's get back to Occ Health a little bit.
Okay.
Is occupational health like a specialty, or do you have Occ Health physicians and nursing staff? Are those?
You know, that's a question I get a lot. Like, do you see us as a specialty? Even when I talk with our own physicians within CHI, a lot of people don't see occupational health as a specialty. Now, if you were to ask an employer, they definitely see it as a specialty.
Right.
And so knowing the importance of getting employees in the right place, you know, for the work injury care, for, you know, how it's managed. Our physicians that work in occupational medicine every single day, you know, they understand OSHA regulations, they understand Department of Transportation regulations, and that's very key in treating work injuries and knowing how to write restrictions, knowing what it means to just take somebody off of work just because, you know, and the one thing I always emphasize is patient care is our number one priority. And then after we're done with that patient, you know, it's communicating with the employer or a case manager or a work comp insurance company. There's so many entities that get involved when it's work-related versus personal. So, you know, I do see us as a specialty. You know, if we prescribe a medication versus over-the-counter, how that affects the employer.
Absolutely.
And that OSHA 300 log. And, you know, unfortunately, that's the way the system is set up. And if the patient can tolerate over-the-counter, we certainly try and do that first. But if we have to, for the care of the patient, prescribe something, then that's how it has to go. We're not going to compromise the care of a patient knowing those things, but we're very conscious about them as we're treating and writing those restrictions. And, you know, our docs always think modified duty. You know, that's just automatically what they think.
Rather than sending them home.
Rather than send them home. Because if the employer can accommodate the restrictions that we write, you know, let them be the ones to send them home because they can't accommodate, not us.
Right. I love that. It's interesting that you said that. So when I was with OSHA back probably 20 years ago or so, when they rewrote the record-keeping regulation, the folks from the national office came to us and said, this is going to require significantly greater communication between the employer and the provider, because things that the provider does can impact those record-keeping requirements.
Absolutely.
And they may not know that. So if you send an employee goes to their personal physician, and I think that's an option here in Nebraska,
it
if I'm not
it's
mistaken.
a choice of doctor state.
Yeah, so they go to their personal physician who has no idea what those DOT or OSHA regulations are, or how their treatment choices can impact those things, the employer. Or the emergency room, for example. You go to the emergency room instead of an Occ Health clinic for some of these things. The impact is significant, and we were trying to encourage employers to open up those lines of communication with occupational health clinics specifically, just so they didn't have to record things unnecessarily, or, as you said, send people home unnecessarily.
So there's a couple of things we do to help with that. Number one is we have our docs. Anytime an initial injury comes into the clinic, our physician will reach out to that employer contact to discuss what happened, here's what we're seeing, here's the restrictions if there are any. And I'm trying to think of the second thing. I just lost my train of thought. But we were talking about connecting the employer.
With those providers, just to make sure that those, just like you said, like the over-the-counter things rather than prescription medications can change the outcome. And I know OSHA was never interested in telling the providers how to treat.
Correct.
We had no interest in that. But if the two options were available, one has a significantly less significant impact on the employer.
Yeah.
So we wanted those to encourage those things.
That'll come back to me. I can't think of the other thing.
Oh, no, you're fine.
It happens to me all the time. This is all brand new to me. I knew Occ Health just scratching the surface, but, since getting in contact with JoAnne, and we have more of a regular cadence of meetings now, and that was something that I never recognized, was that all of the nuances that make Occ Health special and different, and how that appeals to employers. So we were talking about just internally the education with our providers outside of Occ Health to really have them direct people to our Occ. This is just communication
internally.
That is
exactly what my second point was.
Okay, you're welcome. You're welcome.
You
but yeah,
helped
just
me.
That internal communication, never mind externally, because we're never going to get everybody to understand this fully.
Right.
But if we can at least work internally with our own employed providers.
And I do take time to do that. That was the second piece to that, is that I work with our own primary care physicians, any physicians I can get in front of to talk about occupational health, and let them know that, hey, it's a choice of doctor state, that they may be your patient and want to come to you for the work injury piece. And if you decide to keep it, great. But here's the expectation when that happens. If you decide that, hey, I don't want to get in the middle of work-related versus personal, and I have the rest of their family doctoring with me, because sometimes the occupational health physician doesn't always tell the patient what they want to hear, as far as we think
that can be a tough.
We think you can go back to work and do light duty.
Right, of course.
So that always can put that primary care in a really bad position.
I agree.
But initially, though, with that primary care, oftentimes they're saying, well, I'm that person's doc. I know him best, and I really don't want him to tell them to go elsewhere, because that could hurt the relationship. But what could hurt the relationship more is if you have to have these tough conversations, and maybe either that provider avoids it altogether, or they have it and at risk of losing them.
Yeah.
So I think that, and it was funny because yesterday I met with a doc after our meeting, and he said, JoAnne's already talked to me, because I was going to talk to him a little bit. I was going to touch on this a little bit, and he's like, I already know. It is something that we need to keep talking about.
But this is a big deal. And I've seen over the last 35 years a number of instances where that primary care physician who does not have the occupational health background or experience necessarily makes questionable decisions, and I'm not I'm not licensed to practice medicine in Nebraska, but I think
in Nebraska.
Well, outside the country, that may be different. I put some stitches in people, but I don't think you have to have a degree to do that, do you?
No, not at all.
Okay, I've done that a few times, just on the fly. But I do think that, as you said, that sometimes, and I don't mean to cast aspersions, but employees seek out a favorable diagnosis from their primary care physician rather than go to an occupational health specialist.
And employers have been guilty of it too.
Of course, yeah. I know.
If they know that they can go to this primary care doc and this primary care doc will get them what they want.
Mm-hmm. I know that's difficult.
That is a fine line. We have dealt, in the 18 or 16 years, I guess, that I've done occupational medicine, along with some leadership that our physician, our medical director, Dr. Duran, Lisa Haas, even Chris, our drug testing coordinator in Lincoln, we've all worked together in that 16 years. Mm-hmm. And to have that amount of leadership and experience helping guide some of the situations that do walk into our clinics, whether it be in Lincoln, Omaha, Council Bluffs. And believe me, every time we think we've seen it all, we are.
Sure.
We come across new challenges when it comes to helping employers navigate a difficult situation. Mm-hmm. I mean, you do have people that are out there trying to play the game. And, occupational medicine really has to play the middleman role and do it well so that everybody, has the outcome that they're hoping for.
Right.
And I think that's where a primary care may not know how to navigate, be in the middle of the road.
I know.
And so that's why I do work with our physicians to say, if you would like to, refer that on to us, we are more than happy to keep anything work-related medical, the work injuries. I think employers are happier when that happens. I think the patient care gets managed so that we're not, that's their bread and butter. Right. People think they'll get rich sitting at home collecting workers' compensation, and it really isn't what everybody thinks it is.
No, I know. I agree.
And I think you have regrets in the end. Mm-hmm. So us trying to help keep people working, if at all possible, is really our goal.
No doubt. Yeah. So let me ask you something else. So I've been to a few locations. Some of my clients are using kind of a telehealth system now for these occupational health, maybe less severe issues that might occur in the work environment. They can do these. Yeah. I don't have to actually go into the clinic necessarily. Do you guys do that? Do we do Are we doing that or dabbling in that at all?
We do it for non-work related.
I was going to say,
we do.
That's part of the portfolio
virtual
that I can
is something we've
offer.
Always had.
Okay, virtual
available.
Care. Mm-hmm.
As far as telemedicine for occupational health, we have done some of it in situations. The problem with telemedicine is that you have to have equipment at the other end.
Right.
You have to have a healthcare staff of some sort at the other end that the doctor can guide. I know we've done some internally for our own CHI health employees with like Carney or, but as far as opening it up to the occupational health world, at this time, it is something we're always looking into. But there's parts and pieces that have to be in place, especially when you're talking work injury care.
Right.
Now, from a mental health perspective, I don't, that's a separate division from what we do. But as far as our program and treating work injuries, it's more difficult.
Okay, interesting. I'm interested in the evolution of this practice at some point.
We've come a long way already.
Done, right? I mean, I've got a couple of years of this left, and then I'm done. I'm passing it on to the next generation. And one of the things that I find fascinating is the utilization of technologies and stuff to do what, I'm the canary in the coal mine, vintage, and so these new young safety and health professionals, occupational health providers, have new technologies, new approaches. I'm fascinated by that. I'm afraid of it.
Well, and the pandemic kind of forced us into that,
I think so.
For a good reason. I can speak on the mental health piece of it. In the midst of the pandemic, I think a lot of different mental health entities weren't quite there yet, but they had to go full steam ahead. Otherwise, they would have to shut their doors.
And learn on the fly. I mean, they
yes,
just had to figure
absolutely.
it out.
I think it forced a lot of people to learn how to do things virtually.
Yeah.
And a lot of, patients or clients, and I can only really speak in Nebraska specifically, were a little gun shy about that at first, but then once they put their feet in the water and experienced it and had some good outcomes with doing virtual health to some capacity, whether it was mental health or even just primary care, and like JoAnne mentioned, that's nothing new for us. We have been doing virtual care long before the pandemic even, but it is something that has its place in the world in healthcare for sure.
Yeah,
for sure. Our virtual care offerings are very, they're very highly utilized, and we can offer that to employer groups. And when it comes to a primary care option, whether they want to just pay for something on a monthly basis for their employees to have an extra primary care option through us. So those are options we do have available.
I know a lot of my clients are very remote. They're located way out of town. We're good? Way out of town. This is how Cam communicates with me. So it's like, oblivious as always. I'm a trained observer, by the way. I don't notice anything. I hate to reveal that at this point, but
yeah, we only got a couple years left.
I've only got a couple years left.
Yeah, you're good.
That's right. So I think there is some utility in that to be able to at least speak with someone.
Those populations that have been pretty desolate for a long time.
Yeah,
that haven't had the resources at hand. But like JoAnne mentioned, they have to have the ability to have that technology on their end too, which sometimes people don't think about. We need to do this and this and this when it comes to technology. Well, that's fine and great, but if you're talking about different populations, whether it's rural, whether it's very, very blue collar, may not be very familiar with technology, there's a lot of education and support that come into that.
I can see that, definitely. So from an occupational health standpoint, one of the biggest issues that I see as the guy out in the facility is getting guys to shave to get fit tested.
Yes.
So, and I don't mean to just hone in on one specific group.
That got really specific.
So it got very specific, but I was just thinking about
that's a real
things
problem
that I see. And one of the things that I see as an industrial hygienist, I'll go out and do monitoring, and we will determine from those results what steps the employer needs to take. And occasionally that will lead to respiratory protection until we can get a handle on those emissions or those air contaminants, whatever. And so I look at this group of guys. Most of them look like Cam, these bearded, big, gruff dudes. And I'm like, well, all of you have to shave. And they, I think, they would rather breathe the air contaminants than shave half the time.
Well, and when silica physicals came out, about 5 years ago?
Yeah, it was about 5 years ago.
When OSHA started regulating the silica dust.
Yeah.
That was a huge problem because you have construction workers that are out in the sun. A lot of them have beards. Now they got to shave them, plus they got a mask. Mm-hmm. And, that would be tough.
Yeah, they almost mutiny in most of the time.
Mask and air conditioning.
Absolutely. It's horrible. Respirators are horrible. I used to be on OSHA's HAZWOPER team, their emergency response team, and we'd have to put them on and wear full face respirators in the heat, and it was just awful.
Yeah, so that is a true problem.
It is difficult.
Getting people to shave and understand you need a good seal. Mm-hmm. I mean, that is the hard part.
It is.
And they got to do it every day.
I know. They have to stay. It's not just once for the fit test and then let your beard grow back in an hour, some guys.
Exactly.
So that's interesting, though. This is one of my concerns about the pandemic.
Yeah.
Was the effect that it had on the perceptions of respiratory protection.
Right.
There were so many arguments, and you saw all this communication and all these social media commentary about the effectiveness of wearing a sock over your face or wearing a surgical mask or wearing an N95 or all of these. I'd see people in full face respirators at the grocery store, and which was always eerie. I thought I was going to wear my papper in sometime just to go get some milk or something to see what people.
That would have been hilarious.
But it has really set us back, don't you? Would you agree?
Oh yeah.
I mean, people who were starting to understand what we meant by respiratory protection, all of this stuff.
There was too many arguments for it, against it, around it. I mean,
and just the guys pulling up these, that neck
gator.
They pull that gator thing up.
Yeah.
And I mean, they can see through it.
Yeah.
I don't really have the heart to say, man, I'm not sure that's helping immensely.
Yeah. This is a whole nother layer I didn't even think of for people. I had thought about it for the healthcare industry, for those folks that have had to wear masks their entire career.
Yeah.
But I didn't even think about some of these lines of work and the complexities that you would have to face educating.
When that all hit, we were getting calls right and left, especially dental offices, having to put on the N95s. And then there weren't any N95s to be tested with. And so then it was, can we just get a mask, And so there were a lot of challenges with that piece when this all hit.
I think it's really set us back.
I do too.
I think people are more confused than ever about some of these things.
I think there's a lot of confusion about a lot of things. And, I think the people, for the most part, employers followed the CDC guidelines, as did we. So, watching the news, I think, is where you get confused sometimes.
A good point. I totally agree.
I think I personally... I shut the news off in March of 2020. I couldn't take it anymore. And just the, reporting so many different things. You didn't know what was real, what wasn't, and it was putting fear in everybody. And so I just felt for my mental health, I had to shut that off and just listen to the local news and follow the guidelines CHI provided us. So
interesting.
That is really where I went with that. And we had a lot of employers reach out to us that typically didn't even use our clinics, but we were seen as the person to reach out to for that information.
Good.
And I think that's what is really neat about our Occ Health is that it's connected to our healthcare system. And we are the experts when it comes to healthcare in general. So what better place to turn for Occ Health? But this was one of the questions I had asked JoAnne a couple weeks ago when we were talking about prepping for the podcast of what have you seen?
Prepping for
the
podcast?
Loosely. Really? I use that. I'll put air quotes around it.
5 minutes.
Okay, well, good.
Yeah. I had a few bullet points of what I wanted to touch on, but one of which was, what did we see during the pandemic? Because I didn't come to this healthcare system. I was in a different healthcare system, but what did you experience in Occ Health during the pandemic that you hadn't seen before? And some of this kind of stuff was brought up, but she had also mentioned different drug screenings that employers were...
Now with all the staffing shortages, I've seen a trend of companies removing THC from the drug testing because they can't get anybody to pass a drug scran.
I'd heard that. I've heard that same thing.
We're getting surrounded by marijuana, so, we're the state that it's not legal, but yet... People, that's the one thing that they're coming back positive for, and companies are like, well,
so if that's going to be the disqualifier, maybe we need to change our view on that, perhaps, at least from an employment standpoint.
Exactly. So
I've heard that many times.
That is a trend right now, is taking that THC, and I'm not seeing it happen with the majority of companies, just a few, but there are people that are struggling to get a body to be there to do the work.
Without question. Yeah, the entry level labor positions that all of my clients are trying to fill, they are all looking for labor. If people aren't working right now, it's probably by choice, perhaps, or maybe some other reason that they're unable to work, but I don't mean to be judgmental, but it's probably not the cream of the crop necessarily.
Right.
It's a horrible thing to say, but and so it can be very difficult to find people that can pass a drug screen or some of the other, the testing that we have to do to see if someone's capable of doing certain jobs.
They really only have changed that on the pre-employment side, but not the post-accident. So post-accident, they're still going to test for the THC. It's just not on the pre-employment.
Interesting. That's an interesting comment, too, because... OSHA had taken a position a few years ago about drug screening.
Right.
And how drug screening could be discriminatory. OSHA doesn't like anything that can be perceived as discriminatory, whether it's this is a realistic fear or not. I have my doubts, but they were concerned that just across the board drug screening, either pre-employment or post-incident, if there was no cause, if there was no discernible cause for that drug screen, could be discriminatory and might quash people reporting incidents. They might know that they'd have to go get drug tested, so I'm not going to tell anybody that I just, cut these fingers off or whatever.
Well, and speaking of that, we used to, when I would set up companies to do work injury care with us, I always told them consistency is what keeps you from getting discriminated.
Yes, exactly. Don't do this arbitrarily or with some bias.
OSHA, when they changed that, now employers were confused.
They were freaked out.
Now I'm not supposed to drug test unless I have a reason to drug test.
I know.
So now employers are having to decide, is this a reason to drug test?
I know. And
so pretty much all of them are optional now, where they have to tell us when they need the testing.
I don't love that.
And that is a big change that shifted that. I think that was like 5 years ago.
That was probably
maybe?
about in that same time. Yeah.
It seems to be left to so much interpretation that I don't like that.
And the employers are not the experts in that, They don't want to be making that decision.
Not. Yeah.
Because now it always seems discriminatory because...
Correct.
That's what immediately went to my mind.
Yeah, why would you test Doug? Well,
See, to me, it took the consistency piece out of it and made it where now they can get in trouble.
I totally agree. I didn't love that either.
Yeah. So that's been a struggle for employers as well.
Yeah, I know. That is difficult. And there's so much for the employers to be aware of when it comes to even just the occupational health piece, the work comp piece, all of those things. It's hard to navigate, and so it's really nice to be able to contact someone who has expertise in this to help them navigate some of these questions. So you spend a lot of time doing education.
I do.
Questions.
I am kind of the point of contact for all things Occ Health with our CHI Health program. And, I even work with companies. I tell them whether you use our clinics or not, take the time to set up protocols. Because I said there are so many different ways patients come in our front door. And it's better that we have a protocol in place than nothing at all. And then I don't have to reach out to you at the last minute trying to pull something together so the patient has a good experience in the clinic. So I have worked with hundreds and hundreds of companies, maybe thousands these days, just to help them get those protocols in place. And, really, and they reach out to me to talk about fit for duty, return to work situations, and what should we be doing with that and things like that. So, I do a lot of education with the people that use our clinics.
JoAnne is a wealth of knowledge. I mean, really. Not just Occ Health, but just, being in CHI for a long time, she has become my go-to for a lot of things.
Good.
But, Occ Health specifically, and as you can see, she's very passionate about it.
I am.
I love that,
I can appreciate that.
I have to credit, though, the team of people I've worked with all these years, Dr. Durand and Lisa and Chris and all the people internally, even up in Omaha, that have taught me a lot of things.
Absolutely.
Without that, I probably wouldn't know as much as I know. And I've been very fortunate to be a part of a team that's taken the time to explain the why of everything.
It sounds like CHI is a pretty good team all around.
Yes.
Yeah.
Nice.
Absolutely.
A kind of a community resource for any number of different health-related things.
And, we're hoping to put on an employer forum here in the next few months, hopefully up here in Omaha, that we can bring in other resources that are important to employers, like our EAP program, our MD Save program. We want to bring people in from our priority care clinics to explain what is priority care. It's basically urgent care at a family copay price. And if you don't have and they have walk-in hours from 8 to 8 7 days a week. And a lot of people aren't aware of that.
Our priority care has just gone gangbusters over the last couple of years. We've seen such a substantial decrease in our ED visits, and we credit priority care to that.
Nice.
It's been
and a lot of people
That's
use
fantastic.
urgent cares and don't want to connect with a primary care. Well, you get the opportunity to do that when you come to a priority care. Because it's not good to have your medical records all over the place,
right,
especially if they're helping you manage a chronic condition.
Absolutely.
And then we also have our physical therapy areas that work with us in Occ Health to provide like functional type screening and back screening for all the companies that utilize our clinics. And then they can also see work-related patients or personally as well. So just lots of good entities that help us deliver really good health care to companies and their employees.
Nice. I'm gonna one more accolade, and I'm not. You're not paying me to say these things, obviously, are you? We can talk about that. But so when my wife went to work for CHI, she works at Lakeside. And she carries our insurance. Bless you. As a self-employed guy, insurance is very expensive. I've still got 2 sons on the payroll, I mean, you would have think at 24 and 22 they'd be off the payroll, but no.
Oh, they were going to hold you till that age.
They're going to be there until the bitter end. But we had to transfer pharmacies. So when she left the school district, which was a different system, to CHI, I got a notification, your prescriptions have to be switched over to a
CHI pharmacy.
I was so mad. And then I called the Lakeside Pharmacy and spoke with some wonderful person who, I can do all that for you. I was like, you can? Just give me, who's your doctor and where do you go now or what do you use now? And I told her, and literally in 10 minutes, she had transferred everything over. My prescription was ready to pick up. It was just amazing.
And the cost.
And the cost was great. I got, 90 days instead of 3 days, which I think the old system was like, had to refill it every 3 hours or something, I mean, it was just.
Yeah.
So I was actually mad until I spoke with her, and she was fantastic. I wish I remembered her name, but they were terrific. So it's just amazing. Good
we have
you.
Great benefits too, and our benefits are something that I speak to when I talk to employer broker groups, because this is something we can offer other employers. But it's so good that, in fact, I made the switch. I switched everything over, and this is the first time I've done that, because I have worked for other systems, and this is the first time I switched everyone over because it is that good, and that is something we can offer employer groups.
It's cool.
Yeah.
It's really cool. It seems like a fantastic place to work. The services that you provide are fantastic. The Occ Health stuff, every employer that I work with needs an Occ Health clinic. Whether you are required to do respiratory protection or medical surveillance or anything, you just need an occupational health provider.
You need somebody in your back pocket.
As a resource.
Yes, you need that.
And you know how you're a consultant to so many companies? I'm kind of that Occ Health person that I'm the one person any company can reach out to, and we can go from there.
You don't have to have a contract. You don't have to have those things in place.
We do not need to have a contract.
It could be an immediate need right then and there, and JoAnne and our Occ Health team can be the go-to.
It's fantastic.
And I'm glad you brought up the contract piece. A lot of people think they have to set up a contract with us. You do not. We work with protocols, not contracts. So, and protocols that are specific to you, the employer, and how you want the communication to flow. So that's really what the protocols are all about.
And we've had a lot of recent companies come on board with us because of being dissatisfied with where they were at previously, whether it's the timeline of services or the quality of services. So, that's been nice to see too as testimonials to the work that we do.
Absolutely. Fantastic.
Yeah.
One last question. Educational pieces. Do you do occupational health education out in the community, or can you, if you are asked, can you do those things? Or?
We can. It depends on what the ask is.
Of course.
Usually people will call me up and ask me what they would like to have us come and talk about. If it's not something that I specifically do, I can usually reach out to physical therapy, or I can reach out to whomever to help come and talk about that. I know a big ask in the past has been, can you come out and show the importance of stretching at work every day? So, the physical therapist would bring out stretching posters.
Sure.
And share them with employers and talk and have everybody get up and do the stretches with them and say how important it is every day to be stretching, especially when you're in a very physical job.
Of course.
And we have a service called, we just generalize it by calling it the Speakers Bureau, but anybody can reach out to me, and if they had a specific request, maybe it's diabetes related, diabetes education, or maybe it is a mental health issue or OC health concern, and they wanted somebody, I would just connect them to that entity.
Okay.
Yeah.
Fantastic. Yeah. So we will have to be sure to put that contact information in the notes for the episode, and when I send all this announcement out, we'll put that in there so everybody can have access.
Perfect.
Sounds fantastic.
That's great.
Thank you, guys.
Thank you.
I think are we running up on our hour, Cam? Whatever. I have no idea how much time. Time is just this weird construct that I don't really understand, obviously. It's been
clock.
Fantastic. Thank you. Yeah, there is no clock. Have you noticed that?
I noticed that.
Did you? Because I don't put a watch out or, I don't even bother. But I can almost tell an hour anymore. It's kind of weird.
Yeah.
But this is fantastic. Sounds like CHI is fantastic. Thank you for employing my wife. If that was one of your choices, I don't know.
No,
she
neither.
loves
I wasn't in the interview, but
she
we're
loves
glad
it.
to have her.
Absolutely.
Yeah.
Thank you for ensuring my family.
Yes,
my
you're
boys
welcome.
appreciate
You're
it.
welcome.
And the information and what you're doing out in the community.
Anything we can do for you.
I appreciate
just let us
that.
know.
Yeah.
No, this is fantastic. The information is great. The occupational health services are really critical. Everybody needs to be aligned with an occupational health provider to be able to get that information, get those services. So this is terrific. Thank you.
Yes.
Thank you.
Thanks for coming. It's Friday. I hope everybody has a great weekend. I hope you had a good week.
Yes.
It was hot here in Omaha this week, and we had a few of those high heat index days. I hope everyone is acclimatizing to the heat and getting their workers prepared for a hot summer.
Right.
That's always a big issue occupationally.
Especially so early on.
Early in the year. It's a little early for this kind of heat.
For 90-some degrees.
I know.
Yeah.
I think on Tuesday or Thursday, we were in the 90s. I've got a little app on my phone. I plug in the ambient temperature and the humidity, and it gives me the heat index. And we had some high heat indexes this week. So I hope everybody's focusing on that. Make sure you're looking out for your employees. Otherwise, have a great weekend. I look forward to having you guys back in 6 months or a year, and you can tell me more about what's been going on if we open up some new clinics and things like that.
Yeah.
So thank you, guys. I appreciate it.
Thank you. Thanks.
Thanks, everybody. Have a good weekend, and we'll talk to you next week.